let us learn about the next topic, that is ischiorectal fossa. It is also known as ischioanal fossa. Now in the perineum region, first I told you there will be a urogenital triangle and then there will be anal triangle behind. Now in the anal triangle behind, you'll be able to see this fossa that is known as ischiorectal fossa. And we are actually seeing this diagram in coronal section. So we are taking a coronal section through the rectum and anal canal, and then we are able to see the diagram from the front. Just for the sake of understanding, the upper expanded part here is nothing but your ileum, and this lowermost part here is nothing but the ischium. Will be having ischial tuberosity on which we are sitting right now, and the part meeting in the front will be pubis. That is actually removed in the coronal section here. You'll not be able to appreciate pubis in this diagram. So ischium, ileum and the pubis. Now here this is actually the rectum part, and rectum will continue down to anal canal, and that is the reason why the name is given as ischiorectal. Between these two there is a fossa that you are able to appreciate. I hope you are able to see this fossa here, guys. That is the reason why this fossa is named as ischiorectal fossa, or else it is also known as the ischioanal fossa, because it is between the ischium and anal canal. Now once you have understood the meaning of the name, why this fossa is given the name as ischiorectal fossa or ischioanal fossa, once you understood the name here, the only thing that you have to learn here is about the boundaries and contents of ischiorectal fossa. Now in the boundaries, I hope you are able to appreciate this muscle here. This muscle here will be the obturator internus muscle. And obturator internus muscle is the one which is going to form the lateral boundary of the ischiorectal fossa. It is forming the lateral boundary. And then there will be the muscles which are sloping down here. This is levator ani muscle. Those levator ani muscle which are actually contributing for the formation of the pelvic diaphragm, that is levator ani. And this is the external anal sphincter. External anal sphincter. So levator ani and external anal sphincter, they are the one which are going to form the medial boundary of ischiorectal fossa. That is going to form the medial boundary of ischiorectal fossa. Now what is going to form the base of that one, or the inferior boundary of that one? Obviously the skin in the gluteal region here, that is going to form the base or the inferior boundary of this one. So laterally we have got obturator internus muscle, and medially we have levator ani along with the external anal sphincter, and then below you'll be able to appreciate the skin of the gluteal region. Perfect. But sir, what about the anterior boundary and posterior boundary of ischiorectal fossa? You'll not be able to appreciate the anterior and posterior boundary in this diagram here. To see the anterior and posterior boundary, what we are going to do is, we are going to see from the inferior view, from the inferior aspect. So just look at my hand here, guys. Imagine this hand here, the right hand here, to be the anterior boundary, and this is the posterior boundary here. And there is a ischiorectal fossa in the middle here. And now we are going to lift this and see from below. So let us just lift and see from below. So what is going to happen, this my right hand here, which is the anterior boundary, is going to come up here like this, and the left hand here, which is going to form the posterior boundary, is going to come here like this, guys. So this is the anterior boundary and this is the posterior boundary. Now keeping this concept in the mind, let's turn this diagram and let's have a view from below, that is inferior view. So what is that hand above here? That is the anterior boundary, and we can clearly appreciate here this anterior boundary is the one which is formed by membrane, and that is the perineal membrane. And what about the posterior boundary? The posterior boundary is actually formed by a ligament between the sacrum and ischial tuberosity, sacrotuberous ligament, and that ligament itself is one of the important structure from where many fibers of gluteus maximus muscle are going to originate. So this you can see the gluteus maximus muscle originating from here, and that is going to form the posterior boundary of ischiorectal fossa. So let us just write down here ischiorectal fossa, or else the another name of this one is ischioanal fossa. Perfect. Now what will be the boundaries of ischiorectal fossa? Remember, laterally first of all you'll be having obturator internus muscle, laterally, and then medially we have got the levator ani muscle along with external anal sphincter, muscle. And then what is going to form the base? The base is actually formed by the skin in the gluteal region. skin of gluteal region. Then the most important one to understand here, the anterior boundary and the posterior boundary. Anteriorly, you'll be actually having a membrane, that is perineal membrane, which I have actually shown you in a different orientation, guys, in the lithotomic position basically we have seen. And what is going to form the posterior boundary? The posterior boundary is formed by sacrotuberous ligament. Sacrotuberous ligament, and along with that sacrotuberous ligament, you have gluteus maximus muscle originating from there, guys. So these are all the boundaries of ischiorectal fossa or ischioanal fossa. You have to know the boundaries comfortably, and not only learning theoretically, guys, you have to be comfortable with the diagram as well. Why? Because that was given as a image based question in the AIMS exam. Now once you are done with the boundaries, what will be the content? Content is very simple here. This ischiorectal fossa, it is actually filled with fat. You are able to see that yellow colored dense fat there. So the ischiorectal fossa is actually having fat, but along with the fat, there will be pudendal canal, and pudendal canal along with its contents also. Now, what will be the contents of pudendal canal? We all know very well the pudendal canal is the one which will consist of pudendal nerve along with the internal pudendal vessels. Pudendal nerve along with the internal pudendal vessels. There is internal pudendal artery and vein. But one more thing which most of the students will tend to forget here, the important one, will be the inferior rectal vessels here. Even the inferior rectal vessels and inferior rectal nerve is also a content of the ischiorectal fossa. Now, when you study about the rectum, guys, we have seen there will be superior rectal artery, the middle rectal artery, and there will be inferior rectal artery and all. Now, superior rectal artery, try to recall from the abdomen topic. It is actually the continuation of inferior mesenteric artery. Middle rectal artery, it is actually a branch of internal iliac only. But whereas inferior rectal is actually a branch which will be a branch of your internal pudendal only. Internal pudendal only, guys. Now in this diagram, we can easily understand here. Let me show you the picture here, guys. Where are all these contents present? So we can understand very easily in this diagram here. First of all, in the ischiorectal fossa, we can clearly see it is filled with fat. Okay. And apart from that, if I just zoom this one here, I hope you are able to appreciate here this canal is the pudendal canal. And inside the pudendal canal, you'll be able to appreciate the nerve, artery, and the vein. The pudendal nerve, the internal pudendal artery and vein, guys. So that is about the boundaries and contents of ischiorectal fossa crystal clearly. Now let us do one thing. Let's go in a little bit of more depth right now and try to understand some more points regarding this ischiorectal fossa. And to make you understand that, let's draw the diagram of this one. So imagine this one here to be the rectum and anal canal. The rectum and the anal canal. Perfect. Now this one here, you just imagine this one to be the skin of the gluteal region. This is the skin of the gluteal region over here. Now what is the muscle that is present towards the lateral aspect here? This will be the obturator internus muscle. Obturator internus muscle. And then here you'll be actually able to appreciate the levator ani muscle. That is levator ani muscle towards the medial side, along with the external anal sphincter muscle. That is going to form the medial boundary. Now there is one fascia which will be covering this obturator internus muscle. And that fascia is referred to as the obturator fascia. So obturator internus muscle is covered by a fascia. That fascia is nothing but obturator fascia. Similarly, the levator ani muscle is also covered by a fascia here. And this fascia is actually referred to as the anal fascia. Levator ani muscle, anal fascia. And then one more thing, there will be one more fascia here from that white line of Hilton. So from the white line of Hilton, there will be one fascia going transversely here like this. And this fascia is referred to as the perineal fascia. Perineal fascia. So there will be obturator fascia, the anal fascia, and then there will be perineal fascia. And connecting these two, that is the anal fascia and the obturator fascia, somewhere here there will be one more fascia that will be the lunate fascia here. This is the lunate fascia. The shape itself is telling you lunate fascia. Like between the anal fascia and the obturator fascia, you'll be able to appreciate one more, that is a lunate fascia. And why I'm telling you about all these things here? Why? Because all these fascia are the one which are contributing to the formation of a canal here, and this canal here will be the pudendal canal. So pudendal canal is actually formed by the contribution from all these fascia, guys. Now, one more thing to learn here, one last and final thing to learn here, guys. Once you have learned about all this fascia crystal clearly, now because of all this fascia, this entire region is divided into three parts over here. I'm able to see like number 1 here, and then there will be number 2 here, and then there will be number 3 here. Now, what will be the names of these three parts? Number 1, that is known as the perineal. That is known as the perineal space here. Number 2, that is the actual ischiorectal fossa. That is the reason why it is known as the ischiorectal fossa proper. And number 3, the part that you are able to see above the lunate fascia, that will be the suprategmental space. So there is a space present below that perineal fascia, that is nothing but the perineal space. And between the perineal fascia and the lunate fascia, that is nothing but actual ischiorectal fossa proper. And above the lunate fascia, that space is actually known as the suprategmental space. So this is all the information that you have to know about the ischiorectal fossa in a crystal clear manner. So all the boundaries, the content of that, and this division of the spaces along with the fascia there, guys. That's all about the ischiorectal fossa that you have to know for your exams.